Good morning, everybody. I'm excited to have a slightly different conversation today with Evelyn Rizzo of Mobility HEOR. She focuses on outcome measures, and she'll share with us a little bit more about Mobility HEOR and the prosthetic outcomes that she has a whole separate entity for. But before we jump in, again, just a little short synopsis of calibration marketing. I started it at the beginning of 2024, and the goal is just to provide marketing services to entities within O&P or outside that don't have the capacity to bring on a full staff member or have somebody that has left and just need somebody to take on those responsibilities at an ad hoc or project basis, whatever the need may be. So I'm here if you need those services. It's everything between content creation to creating short little webinars similar to this, and anything else that may be kind of on the purview of things that you are too scared to do or just don't have the capacity for. So I invite you to check out calibration.marketing on the web and just learn a little bit more about us, see some of the great resources that are available. But without ado, I will add Evelyn to our conversation. Good morning.
Hey, Linda.
It was great to finally meet at AOPA just 2 weeks ago. Time is flying. So it was great to meet ahead of this and just have a quick, friendly introductory chat. And thank you again for sponsoring the new Partial Hand Solutions Guide. That's how we got to know one another. But share a little bit about yourself, kind of where you got started, and then we'll jump into kind of the meat and potatoes of this discussion.
Great. Thanks, Linda. Yeah, it was great meeting you at AOPA. I had a wonderful time. There was so much good stuff happening there. But
yeah,
I first started in the O&P field in 2008, and I am a University of Pittsburgh grad. I first started at the VA in Cleveland as an intern before going to University of Pittsburgh. And I've worked clinically for over a decade in a couple different clinics between Delaware and Ohio, Nashville. And what continuously was part of my day was trying to appeal coverage denials. And, I'm like, well, how do I prove that these products are, medically necessary or actually make a difference? And just the struggle to find outcomes information, it was just took up too much of my day. And it seemed like something that should already be there, already be available to us as clinicians trying to find the technology for our patients. And I was at a conference and somebody said the words health economics. And I was like, the clouds parted and the sun shone on my face. And I said, that's it. That's what I need to do with myself. That's how I can help my patients, help all of our patients, help anyone with limb loss or limb difference, get all this cool technology that just keeps coming. And we need to be able to give it to people. So how can we do that? And that's what I changed course.
Yeah.
Yeah.
No, it's definitely something that's needed. And it's crazy. I know you and I kind of chatted before we hopped on here. And we'll go down some rabbit holes during this conversation and invite anybody listening in to, drop your questions and comments. But it's mind-blowing to recognize that obviously the world of prosthetics didn't just begin 5-10 years ago. But all these struggles continue to happen because even for the technologies that have been around for maybe a little bit more than a decade, which is kind of like, okay, well, you've now cemented your place in the industry, but insurance does still consider them to be exploratory, certainly not medically necessary. And those manufacturers, I was at one of them, were shaking our heads going, but it's not like we didn't just fall off the truck. Like we've been around, we have research, we have all this stuff behind us, but without those outcome measures and all those greater details, it's almost like you don't have validity, which is nuts.
Absolutely.
So still a lot of work to be done. So I think, as I shared at the beginning, so you have mobility HEOR, and I know you and I talked about, I'm like, how do I say this? Is it HEOR? But basically it's health economics and outcomes research is what it
Correct.
stands for. How does mobility HEOR and prosthetic outcomes, what are those two landscapes look like? And what does each entity do and offer?
So Mobility HEOR is my day job. It is a consultancy that I run. And
Okay.
my clients are generally not in the O&P field yet.
Interesting.
So
Okay.
a lot of the money being spent in HEOR is on the pharma side, med
Mm,
device side. Pharma spends a lot of money in health economics. They're constantly writing papers. I help with manuscript writing just to kind of get these bits of evidence out into the hands of hospital administrators, into the hands of insurers. You know, these little drips of evidence help build these huge, you know, revenue streams for these companies, you know, that they have the evidence to support their devices. And that's how they can charge so much and have, you know, such adaptation of their products. So I see this, and I have had, you know, now 3 years experience working with pharma and seeing how they're doing these things. And, you know, their budgets are, you know, billions and billions of
mm,
dollars, which is you know, not what we see in the O&P field. But you know, I'm kind of sharing some of these techniques with small med tech companies that are starting up, like how, you know, they have great products and they have great dreams and they have, you know, a passion for the patient
mhm,
body that they're trying to serve. But you know, when it comes to the evidence that insurers care about, there's a disconnect. So how can I help, you know, get these great products to the market so patients ever actually get to see them?
right.
So we kind of work. I work with these small medtech companies that are in their first stages of funding, and I can help them, you know, build out like an evidence strategy. Like, look at what the market looks like, what the competitors are doing. Is there coverage? What kind of coverage will they need to get their product? You know, it's great to have a great product, but if insurance isn't going to pay for it, it's just a struggle for the company and a struggle for the patient. So that's the
Mm.
kind of space where I spend most of my time, most of my day. And
Oh,
go
I
ahead.
needed you in my life a couple of years ago, Evelyn. I had no idea when I was struggling to figure. I'm like, how do I do this? I don't have a friend.
Well, I'll be your photo friend anytime.
Yeah. No, I can see a tremendous need for it, especially as all of these startups are blowing up in, I mean, everywhere, right? But certainly in O&P, because that's the world that I'm primarily living in. And the, however, it seems like whether it be a entity that is outside the US, and maybe they have spent a significant amount of time working on evaluations and research and outcomes to some extent, or perhaps they have that great product and they say, well, we've fitted on some users and we've made some adjustments and so on and so forth. Now we're going to enter the US market. We need a sales guy. And I'm always like, oh my God, that's the last thing in the world that you need. Like, maybe eventually, but let's figure out some of these things before. And especially when it comes to FDA and PDAC and all these different things for, lower limb, making sure that your patients aren't falling down the stairs and all, or getting hurt, regardless of what kind of device that they're using. That's huge that you're offering that and are working with med tech companies. What are you seeing? Like, where's the gap in prosthetics
Mm.
in terms of uh, this need? I mean, obviously it's there, but if you started with pharma initially, is it because it's not as frequently sought, or?
Well, I think with the coding, it's like, well, I have a product that I'm going to make fit into this code. And
Mm,
then I don't have to do as much, right? Because I proved to PDAC that this, my foot fits in this code. So then what? Then all I need is a sales guy, you know?
mm,
So maybe that's,
interesting.
where the lack of, I don't have to, publish too many papers but then as a whole, the field suffers. So, and I also hear from people, well, if I spend all this time publishing a paper, then, my competitor doesn't have to publish this paper. So why should I do it if they don't? So that, that's a valid
Mhm.
argument. But then again, where's the evidence? Where's the evidence that can, continually we can build upon as a field to support this technology and support our patients?
Mhm.
So I mean, my call to action for anyone, especially in the manufacturing field, and we do have some champions. We do have some leaders in the manufacturing space that do contribute to the evidence, do publish, and I'm very grateful for these leaders. But there's no reason why smaller companies shouldn't be publishing also.
Is it a cost thing, do you think,
Well,
that smaller entities aren't?
I mean, not everybody's a medical writer, you know?
It's
I mean,
true.
I'm happy to support these projects even if you want me to consult for, an outline or, a
Yeah.
review. But these are kinds of things that, we could add to the literature. I mean, make it indisputable that these products are a necessity for our clients. It shouldn't be denied. What level the patients are. We should be able to support these products for every level of our patients and have an abundance of evidence. There's so many things happening in our field right now where clinicians are collecting the data. They're doing their step counts. They're showing in the
Mhm.
clinic each individual patient is doing all these individual things, and that's wonderful. Let's continue to push this evidence out, create these papers about the product and just help support the distribution and patient access for these products. So I think that's key, is
Yeah.
more publications.
No, it seems crazy that there isn't more. And like we said earlier, obviously all of this tech, not maybe the newer technology, but the field has been around for quite a number of decades. So I know I asked this ahead of time, but like, where is all this information living currently? Or is it just in, the mind of a clinician? And so based on what they've seen from their years in clinic and in practice, they're just kind of applying that know-how, but it's not always written down or, documented for, not saying good, bad, or otherwise. It's just how things have gone.
Oh, well, 100%. I mean, I got to follow and shadow and work with people that mentored me that had this like brain trust of life
Mm,
experience. They may have never read a paper, so that doesn't, but that didn't take away from their amazing
yeah.
contributions to their patients' lives. So it's not that, clinicians necessarily need the papers as much as the insurance companies need the papers to reduce the friction when it comes to patient access. So we
Yeah.
have a whole new education system in O&P. So we're graduating, everybody's got a master's degree, so
Right.
they have to read more papers than anyone ever did, just to get into the field. So certainly we have an up and coming cohort of clinicians that are going to be more suited to reading and consuming the evidence, but contributing to the evidence. So that's good.
Yeah.
Um, but
Yeah, but as you said, it's also about the fact of, from an insurance standpoint, and getting that product approved and that solution approved and getting it through the denials process. And hopefully, now with this larger uprising with, LLPR, the Limb Loss and Preservation Registry, and everything else, hopefully there's more of a tidal shift towards gathering this data. And I know there are some great products out there that help with that. But I know you've got some things you wanted to show as well on the prosthetic outcomes side of things.
Yep.
So if you want to jump into that, I can make sure that it's visible.
Sure.
Um,
And just for some context, insurers write coverage determinations usually on an annual basis, and sometimes they're updated. They're based on a systematic literature review. So that's where our publications as a field, they have to be able to be found. If nobody's publishing, or if it's not out there, it'll never get considered by these coverage determinations. So they're updated, for example, January, and then throughout that whole year, there could be, dozens of publications happening. Your client, loses a limb in July. We have a great product, a great paper was published, but it is not being considered by your payer. So how are you ever supposed to know that that evidence is there? So
right.
here is my solution.
Yeah.
I will share.
Yeah. Let me pump this up. Here we go. And I'll hide us just so it's easier to see here. So this is found on your prosthetic outcomes
Yes.
website. Okay.
Yeah. This is a passion project for me currently. This is something that I just do and put together in my spare time. For a lot of my evidence projects, I use a platform called Nested Knowledge. So
Okay.
this is what you're basically seeing, this embed of the software here. And I'm going to switch screens, because if you're here on this website that I created, you can click this little share button here and you'll see the link. And going through this link here is going to give you a lot more functionality to the platform that you just can't get in the embed I have here on the website. So if you go through that link, you'll have here the full dashboard.
Okay.
And what these are is it's right here, just lower limb prosthetic outcomes. So you could look for BK, AK, and down here on the bottom, you see that there's 80 studies included. So if you narrow it by BK, you're down to 32 studies. You look for K3, now we're down to 23. And that just means that somewhere in the paper, they talked about K3, they talked about BK, and now maybe we want to look at fall prevention or cost. If we bring it down to cost, now we have 11 studies. Right here, we have, we can see how this was searched. And in my ideal universe, I'd like to be able to run these searches monthly. Again, currently it's just a side project, but you can see the date of the search. You can see the search I used to find this. So this all can be replicated. Suppose you want to do your own search. You could just copy this, throw it into PubMed and see what's coming up. Or you just download an Excel sheet here. You can go to File and download the filtered studies. This is going to pull up the start of a systematic literature review. It's going to have all the tags that were placed in the paper with that text. And you can open, let me see if it'll share. I don't know if sometimes popping into, I don't think you can see my Excel sheet, right?
No.
Well, without getting too complicated and switching around, but that's something anybody could do with this platform. And as it progresses, ideally in 2025, I'll have, a sponsor or two to kind of help support this work. So I'm looking at manufacturers to support this, and maybe some collaborations with other, leaders in the field, so anybody, I don't want this to ideally not be behind a paywall, so that, what if not everybody has a membership to some of these organizations.
Oh, that's the truth.
I mean, do you have $350 a year just to read the papers, or, $60 to buy a paper? So these, you might even recognize some of these. We got Dobson here, so kind of a leader in the HEOR space when it comes to prosthetics. So that's the whole idea. I want this, to be easy to use. I'm open to suggestions when it comes to this. Again,
So this is something that you completely on your own created just by scouring this the interwebs, or like how did it all come together?
Well, I've been using that platform, Nested Knowledge, for over 2 years now. In fact, I'm a super user. I have more hours logged in this platform than any other user in the world.
They should sponsor you, Evelyn.
Well, they're not. Their focus is academia and pharma mostly. But
Okay.
I'm like, why can't? And they're using this, and I'm like, why can't we use this in OMP? Like, why can't we use this? We always have the evidence to share with. My thought is the insurers, but what about those physical therapists that we are trying to get referrals from? And there's all sorts of ways that we could use this to build our business and improve patient outcomes and improve patient coverage. So that's that platform. If somebody else wants to use it, I again encourage the development of outcomes no matter what, whether you want my help or
Yeah.
otherwise. You can. I do have a discount code if somebody wants to use the Nested Knowledge platform. Should I share it in the comments?
Yeah, please.
Let's see if I can figure that part out.
Yeah, no, I mean, this is, I don't know enough about this at all. So it's interesting because I'm going to go on and learn more about it. But I guess other than what you had shared earlier of some, I'm sure it's a large number of members of the industry and those that do see these outcomes. What is the biggest concern other than a competitor seeing what they're putting out there? I guess it comes from a place of me asking of, this is why I started these webinars, right? I feel like we're all so guarded and behind a wall that I don't want you to know what we're doing, but these guys also shouldn't know. We're just going to do our own thing. And I just feel like we're all in it for the same reasons.
Right.
We want to make sure that it's accessible and available for people to have the same knowledge, the same kind of thought process. And at the end of the day, it's the user that benefits. And so I guess what's the holdup, man?
I mean, again, not everybody's a medical writer, and it does take time. Especially clinicians, they don't have time. I mean, I worked. You see patients every 30 minutes. I mean, what time they want to get home every night? It's like, I want to get home at some point. So it's I don't. It's no wonder to me. I just wish that the barriers to publication, time and money, there's only so much of that to go around. So that thank you for posting that code.
Yeah, no. So it's scrolling along the bottom there. That's my best way of getting it out to folks that want to be able to utilize that discount.
Right.
But I guess are the efforts of the LLPR and yours similar in nature?
I did talk to them, and I think that they are, there might be some synergy at some point. So what they're collecting these data from all over the place, and you can pay a subscription to utilize everyone's data and do your own publications. But again, there is a financial barrier there, and you could possibly get grants to cover your expenses, and that would be awesome too. But again, not everybody's a grant writer, so I understand that there's some barriers there. So again, my focus would be on having a resource available that there is no cost barrier. So just to have it available. And part of that will also be asking people that have published that their PDF is behind a paywall to perhaps provide their PDF to me so that I can, tag it. It doesn't have to be free to everyone using the software, but I mean, at least I could pull out enough information that would be of interest. So
right. No, I think it's definitely a tremendous effort. And does it currently, and I'll have to take a look at it because I haven't myself, does it cover all areas of O&P, or are you kind of, starting with lower limb and then working your way through, or what can people expect on there?
On my website right
Yeah,
now, it's just lower extremity. So
got it.
I
Okay.
will be adding upper extremity. And then I also have the URL orthoticoutcomes.com. And I'd love to focus on exoskeletal and
Mm.
just those kind of technologies that are reimbursement so challenging. I would like to say that Canada just approved some exoskeletal coverage, which is incredible.
Oh,
So
nice.
that is an amazing accomplishment, um, uh, uh, of our northern neighbors. So
Yeah.
um, that those are the kinds of things that these evidence repositories could help, because maybe it could be a resource for insurers. They don't, whoever has to do these systematic literature reviews every year, how much time do they have? Maybe they could just come to prosthetic outcomes or
Yeah.
orthotic outcomes for. Oh, and a lot of these, I think some of these softwares like Nested Knowledge, where it's like an AI powered
Mhm.
systematic literature review, they are more and more popular. I mean, I think that the HTA, which is the Health Technology Assessment governing bodies, they're promoting their use. FDA is talking about these softwares. There's the manual systematic literature review is dead. There's
Mm.
no reason to start these manual processes. So you could use the software, create your own systematic literature review, and publish. I know that with the Nested Knowledge platform, you can do one free nest beforehand
Okay.
to sign up. So, play around with it. Maybe it'd be something that would really work for you or anyone listening as a clinician. If you
Yeah.
want to publish, like I keep having this problem, and with coverage, you could be the person that does the review and publishes it. So
Yeah.
we don't
No.
have to point fingers. We can just take it on ourselves.
Right. Yeah. No, I hear you. And so I guess, as we kind of wrap things up here, is there anything that you're seeking in terms of help and support from these larger manufacturers, just thought leaders in the industry? How can people help make this into more of gain more access to it and just kind of expand the information that's there,
Yeah.
make it
Well,
more relevant and updated?
correct. That's the key is update, because the software, we can update it. If it's a matter of going in and then tagging all the information and making sure that we have the PDF. So it would take a monthly touch. 10 hours a month just to maintain something like this. So that's where I'm seeking the sponsorship of people within
I
the
hear you.
industry, just to cover the time. Uh, so time away from my other clients. Just
Yeah.
keep this going. So, my I'm open to that, and I'll be pushing more into that in January of 2025.
Yeah. No, let's small business to small business, let's definitely help each other out. And I know it's all of these uh various kind of side projects that we all do, right? As consultants, it all comes from the right place, and for resources that others just don't have time for, but are pining for. And so this is definitely an important one. So, I'm sure people can find you on LinkedIn. They can find you through mobilityheor.com or prostheticoutcomes.com. Is there anything that you want to leave the audience with before we wrap this up?
I just hope that we continue as an O&P profession to push more outcomes. I know it's an exciting time. Every time I go to AOPA, we're talking about it,
Yeah.
and I'm just happy to be here and see the change from what the field was 15 years ago. So that's exciting to me, and I hope that we can all participate in just with the patient access focus, so that we can, get this cool technology and improve the innovation that our patients can get. So
Sure. Yeah, no. Here. So I'm glad that we were able to connect and get to know each other a little bit better. Hopefully, those listening in, this will be live on LinkedIn for the foreseeable future. It'll also be available on YouTube for easier shareability. But I encourage whoever's listening to reach out and, see how they can support this effort. And before we wrap up, our next webinar we've got a quick turnaround here. It's next week, October 3rd, when I'll be welcoming New Tech Synergies. So I encourage you the signups are live now on LinkedIn. I encourage you to sign up, have your questions, learn a little bit more, and join in our little informative fireside chats that we have here. But Evelyn, thank you so much for joining me and sharing more about what you do and kind of the passion behind it.
Thanks a lot, Linda. This was lots of fun.
Yeah, no. All right, everybody, have a great one, and I will see you again soon. Okay.